guys, it's Khaki. I am making this video out of a couple of requests on different topics were not enough to do a whole long video about, but I'm combining them together. The first question that I got asked and request for a video topic is about my decision to drink alcohol after bariatric surgery. As most of you bariatric patients are probably aware of, or may not be, transfer addiction after any type of weight loss surgery is a real risk. The rate of alcoholism after weight loss surgery does increase some. Also, transfer addiction to things like shopping, gambling, uh, sexual activity does increase as well. So, once you are not able, let me just say, most of us who became obese enough to qualify for bariatric surgery used food in ways other than to fuel our bodies. We use them to comfort us, self soothing behavior. And some people, after weight loss surgery, when you can no longer use food in that role, do reach out to other things. I'm sure nobody intends on becoming an alcoholic or getting into massive debt due to shopping or gambling or losing their marriage over sexual behavior. But I think that being able to find comfort in something, that the way that we used to find comfort in food is a very real behavior that is very present and is something that those of us in the bariatric surgery community need to be aware of and need to be mindful of. For me, this is something that I am aware of not only as a gastric bypass patient, but also as a healthcare provider. Alcoholism is real, and that increased risk of alcoholism after bariatric surgery is very real. For me, not drinking alcohol after bariatric surgery was not that it wasn't an option, but I enjoy a cocktail every now and then. I enjoy a glass of wine. The way that I made that decision for myself was I put some safeguards in place. I only have alcohol now some of you may remember I went to Mexico a couple of weeks ago and I did drink alcohol there. But in my home behavior, I only have a drink when I am out for a nice dinner with friends. I do not keep alcohol in my house. Before my gastric bypass, I did. I was not a heavy drinker, but there were nights where I came home and thought, I want a glass of wine or a martini, and I made myself one. So I have chosen, as we've talked about before, I've talked about before in previous videos, creating a safe space. That's one of the decisions that I made. I limit myself to one cocktail, and I do not drink a cocktail or a glass of wine unless it's something special. If I go to a restaurant and all they have got is the run-of-the-mill, $10 a bottle wine, I'm not going to drink a glass of it. But if it's something that's special, or if it's a cocktail bar that is known for its cocktails, I'll drink one. Now, I'm very cognizant not only of the risk for transfer addiction. The other thing that you have to be mindful of when you're drinking alcohol is the empty calories. Alcohol doesn't really give you any nutritional value. A glass of wine, 125 to 150 calories for one glass. A chicken breast, look it up. A good sized chicken breast, about the same. So you have to be mindful too of, is this slowing down my weight loss? If I go out for drinks or a drink and dinner, and the next week I see that my weight loss has slowed down, I take a look at it. But for me, in my situation, I go out to eat a nice dinner probably 2 or 3 times a month with friends. Some weeks it may be 2 nights a week, then I may skip a couple of weeks going out. But that's something that I enjoy doing. I had this surgery to be able to enjoy life more, and that's part of it for me. Now, if I see my weight loss slowing down, or that one, and I am at one thing, we back up and say one thing, I am a absolute Nazi. I hate to say that, but when it comes to putting food in a food diary, I am very much a to the point purist with that. When I have a drink, I put that in my food journal, and I still do not go over my allotted calories for the day. So I journal it, I move on. If I see that my weight loss is slowing down, I'll rethink that. Now, the other question that I have had and people wanted me to talk about is hair loss. At about probably 3.5 months for me, I started having a lot of hair loss. It hit. I had hoped that I would avoid it, but it didn't happen. It has stopped. I still do lose a normal amount of hair, but my hair is also growing back. I went out to brunch today with friends, and one of the people in my group said, "Gosh, your hair looks good." So I'm going to insert a picture here of like my hairline where you can see some new hair growing back. I don't know how well you can see it in the picture, but so guys, if you are in that hair loss phase, which normally for most people from what I've read and seen, 2 months to about 8 months, just know it is transient. It will grow back. I put in an earlier video some colored thickener powder that I got on Amazon that really helped to kind of hide it. I recommend doing something like that and just writing it out. You are gaining a healthier lifestyle, and this is transient. It will grow back, at least in folks that I have seen. Now, the other thing that people have commented about are asking if I've had any negative comments. I haven't really had any negative comments about my weight loss, and like I've said before, I'm very open with the fact that I had bariatric surgery. That's a decision that I made. But I have had a couple of comments that were a little bit hurtful. One from a patient this past week, an older fella. So, sometimes as we get older, we lose our filter. But I was sitting out in the hall at my office charting after seeing him, and he came out and he said to me, "I want you to know you look so much better since you lost all that weight." And I just looked at him and I said, "Thank you." And to myself, I thought, well, and that was hurtful because that kind of goes back to how some people saw me before I lost weight. But those comments are few and far between. He's not the only one that has said that and that has made me think, damn, how bad did I look before? But, you just have to kind of let it roll. That's all I can say. And the positive comments far, far override that. So I hope everybody has a great rest of the weekend. We're going into the work week, so I'm about to start meal prep. I will see everybody on Wednesday for my regular video. Thanks, guys. If you have any questions, feel free to ask. I will do my best to answer them. Or if you have any other video ideas, let me know. Thanks. Bye.